Today I will be talking about burns, the signs and symptoms, pathophysiology, and a little bit about diagnosis. So I will start with burns. Burns is it's a response, it's inflammatory response by the tissues to a cause. A cause can be fire, hot water, hot objects, chemicals such as acids or alkaline substances. So acids could be, battery acid, hydrochloric acid. Then alkalines could be the fertilizers. It has been told that fertilizers are alkaline and they can injure the skin. So farmers can come to you with alkaline burn for their skin. So cold, frostbites can cause that response by the skin tissues, the epidermis, dermis, and hypodermis to the cold, similar to the burn. So it would be a burn. Electricity burns are the most nastiest, and because the injury is very small, like at the tip, but then it kind of spreads as an iceberg under through the tissues and can come out somewhere else. So it can go in the thumb and come out of the toe. It's very, very unusual. What is it? Lightnings go into electricity. Radiation, cancer radiation goes into this section, and respiratory burns. Respiratory burns, inhalation of hot air. Usually the patient will spend extensive time in enclosed area where the fire is occurring, uncontrolled fire, and they inhale the smoke, they inhale the hot air, and that burns and damages the lungs. Also, carbon monoxide goes into this section. They can present with the symptoms. They're pink, very, very cherry-like in color on the skin. And when you check their SpO2, it would be good. It would be 95. But the thing is, the carbon monoxide molecules are attached to those exactly same receptors on the hemoglobin where the oxygen should be attaching. So the pulse oximeter is giving you the wrong reading. So arterial blood gases would be, and there's a test, carbon monoxide levels, something like that, levels that you can obtain that will give you the correct reading of hemoglobin saturation. So you would treat them with oxygen, 100% oxygen. So let's start with the structure of the skin. So there's epidermis. There's a thin top layer. Usually burns to this layer would be superficial, and it's just keratinocytes, just those cells that produce glycopeptides to keep the water inside the body. Then we have dermis. Dermis contains the nerves and the small blood vessels that nourish the dermis, the epidermis. And damages to this layer would be more partial thickness. Some of them, if it's above, let's say it's above the nerve, it would be superficial partial thickness. If it's a little bit below but not complete dermis, then it would be deep partial thickness burn. And if the whole dermis it was burned all the way down to here, then it would be third degree burn. If epidermis, full dermis, and maybe a little bit of hypodermis just right there would be a third degree. If it goes all the way down to the muscle, then it's fourth degree. Okay, so dermis contains the nerves and blood vessels. Oh, one important thing. If the epidermis is burned, then the blood supply is still there. The nerves are injured but not completely damaged, so the patient will experience pain with injury but not complete damage. Injured but not completely destroyed nerves, the patient will experience pain. And blood vessels, since some of the blood vessels were damaged but not everything is completely obliterated, so the wound will be still leaking fluid, and the area would be red from red blood cells leaving the blood vessel. So epidermis, usually wounds are red and painful. That's superficial first degree, and then dermis, the partial thickness superficial burn, also red. The blisters may occur because of the water and moisture trying to leave the blood vessels, and they form the blisters, and it's going to be red from the blood, the iron that colors the area into red. Okay, however, if we go down to the deep partial thickness burn, then it would be between dry. It could be dry or it could be wet, depending how much blood vessels are left. So there could be or might not be blisters, and the area would be like yellow, white, and grayish. Again, depending how much blood vessels are still there, but not as painful because most of the nerves were already damaged. Then hypodermis is this area where the fat is. If we go to the third degree and the patient burned themselves through epidermis, dermis, and a little bit of hypodermis, then there's no blood there coming out, so the wound will be black, gray, whitish, and there would be no pain because there's no nerves left that are sensing the pain, and it would be leather-like. So it would be dry and leather-like. There's no blood leaving for you to see the redness. Okay, and fourth degree, well, all the way to the muscles, usually black, charcoal-like, and they're the most dangerous. So okay, let's go to again the structures and what they're responsible for. So that was just general introduction over one picture I could provide, but let's dig in and get more details. So first layer, epidermis. We got keratinocytes, produce glycolipids, and they prevent water loss. Let's see, hold on. Alright.